The Ellis Talker Show. If you enjoy our content, please like or subscribe.
Hi, welcome to the Ellis Talker Show. I'm DV LeBron. Do you have things you want to get done around the house? Maybe some, change up a kitchen, maybe a bathroom. Check out K&H Construction. Chris Helms out of Waxahachie. He'll take care of you and let him know DV LeBron sent you. Today, my very special guest is Dr. Fernando Cruz, who is a podiatrist here in Ellis County. How you doing, sir?
I'm good. Thank you for having me on the show. I'm excited.
Well, you know what? Feet are something, some people don't like talking about feet, but we're on them all day. And some of us get really big problems with our dogs, as somebody called them. There's always something going on with your feet, especially as you get older. And so you're here in Ellis County, treating people in Ellis County. So I kind of wanted to have you on to talk about some of the common things that happen in feet and some of the things you see and some of the things people could do to prevent stuff. But first, can I get a quick bio on you?
Yeah. So Fernando Cruz, Dr. Fernando Cruz, originally from New York City, New York. Stayed there till my teenage years, went to Maryland and finished up until I got to high school with my mom's side of the family. And then from there, we did my undergrad in North Carolina, Greensboro, North Carolina. Guilford College. I went there because of football, and while I was there, it's interesting because I didn't plan on really science being my major or even like something I really considered. I was really good at science. I actually was science student of the year my freshman through junior year in high school. I always thought it came easy to me. Came into college as a business major, and I switched up my advisor and Craig, who I'm really good friends to this day with. We messaged each other. It's not about 6 months now, but even to this age, I mean, I met him when I was 19 years old. Now I'm 38 and we're still good friends. He looked at my profile from high school, noticed that science was something I was good at. And he said, "You ever thought about science?" I was like, I thought it was easy. He put me in biology 101. And after my first test, I aced it and I actually enjoyed studying for this test. And he was like, I told him, I was like, "Craig, I'm just going to do science. I mean, it's pretty easy." And he kind of looked at different things and he put me on the sports medicine track, which I actually initially thought about doing like a chiropractor or even like physical therapy. And it just happened at my school, our first year, we had to go to 10 presentations. And of the 10 presentations, I played football. So my first semester, I went to like 2 or 3, just basic. I think it was like I didn't follow a PA. I think I saw a PA, but I didn't think anything of it. And then just some other professions. It just happened that I needed 2 more left, and we got done with spring practice. And we had, I think, 2 months left in the semester, and I had to get these presentations done. And one of my classmates said, "There's a podiatrist speaking in the science building." And me not knowing what podiatry was, I said, "Is that a kid's doctor?" I know it's a foot doctor. I was like, "Whatever." Went to the presentation, and the doctor talked about podiatry and everything he did. It was just really interesting. Just his lifestyle and what he did as far as surgery. And also he mentioned a little bit of wound care. I asked him, I'm like, "Hey, do you mind if I just follow you in clinic?" His actual clinic was in about 2 hours away from our college, but he got in contact with the doctor across the street, Dr. Peachtree. And Dr. Peachtree was great. Actually, I followed him a couple of days, then did an internship with him my following year, my sophomore year. And I told him going to my junior, like, I'm just going to do podiatry. I mean, this is pretty cool. I mean, he definitely got me into it. He didn't really push me. He's just himself, and I just enjoyed being around him. And then from there, I went to.
You didn't think it was kind of like some people think, "Ooh, feet." I mean, what do you want to know for feet? Did you get that, or did you just find the anatomy of it and the issues with it fascinating?
I said, yeah, exactly. The issue is fascinating. No, I initially when my friend told me about a foot doctor, I was like, why would somebody be a doctor in feet? Like, it's so weird. That's what I'm saying. Especially in the college youth, you're just like, that's really weird. Then when I saw the doctor's presentation, I was like, oh, like injuries and like people actually have stuff going on. That's why I actually went to follow Dr. Peachtree. Did like a couple of days with him, and I remember even the ingrown toenails. That was my first day. I never even saw never knew what an ingrown toenail was. My first day, we did like 4 ingrown toenail procedures. And I still remember I walked into because our dorm in our building, my room was the first one on the right-hand side. And a couple of rooms down was my one friend who's a gamer. And everybody went to his room. I got in there, it was 10 of us. And I went and they were like, how was your day with podiatrist? I was like, I mean, it was cool. I was like, y'all ever heard of ingrown toenail? It was 10 of us there. I was the only one that nenever heard about ingrown. Everybody had an ingrown.
Everybody had dealt with it, but not you.
The common. And I always remember somebody's, I think it was an old worker. I did groundskeeping a little bit back in high school and in college. And I remember somebody saying that you should get a job that people don't want to do or people absolutely need. And that kind of stuck with me in my head. And I was thinking about the ingrown toenails, and the doctor always said to me, he's like, well, if people stop walking, I'll fire. As long as people keep on walking, I'll have a job. So I was like, that's actually true. I'll always have a job, And then it said it was just interesting seeing the different pathologies. And patients are really sweet. I mean, even down to the wound care part of it, he didn't do a ton of wound care, but some people will just heal up and be so grateful for his help, And even ingrown toenails, ankle injuries, he did surgeries. I actually didn't. Surgeries are really interesting because I didn't get to see his surgeries. I got to see his post-ops, and it went from wild deformities to reconstructions that were fixed. And I was like, "Dude, you do a really good job." And he was like, "Yeah." He was nonchalant about it. He was very humble doctor. Yeah,
Humility goes a long way. Humility can,
absolutely.
because when you think you got it figured out, that's when the body, or for me, HVAC, it's gonna kick your butt when you lose that humility. You're eventually gonna run into something that kicks your butt. So humility is good.
Absolutely. And I mean, he was down to earth. Actually, I followed some other doctors in the clinic, and they just didn't have the same patient care he did. And I would just choose to follow him because I was like, if I'd be a doctor, I want to be like him. That's the only person I want to, as far as podiatry goes. And there was the other doctors had their own things going on, but just Dr. Petrie was a lot, was just super nice. But from there, I went to, it was initially Ohio College of Foot and Ankle, but Kent State bought us out my second year. So we ended up officially becoming Kent State. So yeah, we had to get, our school was in Cleveland, Ohio, and Kent is about almost 2 hours south of us. So we had to drive 2 hours south for our graduation, which kind of is, it's all good. But it's some benefits with Kent going there as far as just how we can do different majors and you can do other things with Kent that wasn't there when we were independent college. And then I did my residency in Cleveland. I stayed in Cleveland for extra 3 years after my 4 years. And then I did my surgical residency through Cleveland Clinic. And then also a sister campus, which is in Mercy, Lorain, Ohio. And then my fiance, which I met during schooling, was from Texas. And now I'm in Texas. Been here now, come July, 8 years.
8 years. And I think I started coming to you at some point, it might be 4 years now, somewhere in the middle of that. So there are common mistakes people make with like shoes and different things that they wear in their feet. So talk to me about, what would you say is like the worst thing you can put on your feet when walking?
Worst thing? I mean, I say it'd be really unsupported shoes, probably the worst. I mean, I would say I always tell patients because Texas is different from where I grew up in Ohio because they do wear sandals, but sandal years were very short lived in the Midwest versus here, it pretty much year round. It could be freezing. People still walk around in sandals. But it's it's different from a supportive sandal and I hate to say it, but like some plastic in a big basket and I'm saying Walmart or something like that, just picking something out and put on your foot. And it's one thing to wear that, if you're going to the beach or somewhere where you can take it off versus you wearing it all day. It's essentially a piece of plastic with some foam to help some cushion a little bit. And you're essentially walking barefoot, which is not a bad thing. There's actually some benefits in barefoot walking, and but it depends on the activities too, and then also limiting it. But good supportive shoe gear, I mean, that's really the biggest thing, and it can vary too so much on even people's foot type too. I'm a big advocate of if you are wearing tennis shoes on a daily basis, going to where I say like if your job means you're gonna be on your feet for multiple hours a day, you need good support. Starting with shoes, going to I recommend a running store, and especially if you're looking at, and obviously I'm not sponsored by anybody, but I like Drac and the Jog. Going somewhere where they can actually kind of follow you and basically see what's your foot type and recommend the type of shoes. I do like a certain amount of shoes as far as a certain type of shoes as far as everyday walking and running, but your foot type plays a big role too. For example, I love Hokas. I have a ton of Hokas. I have 10 pairs of Hokas.
Yes.
And I love Hokas. And then the Podiatry National Conference 2025 was in Dallas. And this is actually the biggest conference I've been to. They had all these different vendors. and Hoka's were there. And I put my name in for a raffle, didn't think anything of it. And I'm winning a pair of Hoka's. There was this one pair of Hoka on that stand that was super nice. It was so nice. And when I won, I said, I want those. Put them on my feet, started walking around. Again, I had a ton of Hoka's. I was walking around, I was like, oh, these feel terrible.
No.
I was like, I was like, these not. And I gave it back to the lady, and she said these are made for really, really, really bad flat feet. They really don't have really a lot of support. They kind of have a little bit of arch support. And I have a mid arch. I don't have a high arch, or I don't have really a super flat foot. I would say on a flatter side, but definitely she gave me another pair, which she's like, this looks like something that, look at your foot that kind of fits you better. I put it on. It was night and day. And the only thing I had those, the same shoes they recommended. I had those and another shoe, similar colors. I like on matching. So I was like, I don't really need these, but they're free, But I mean, that's example. I say that because there's definitely shoes where people are like, oh, I like how they look and everything. And they come in the clinic and say, oh, my feet are killing me. And I pick their shoe. I'm like, this is the reason why. This is not made for your foot. It's made for a high arch. You have a low arch. You're getting way too much support in or vice versa. You have a super high arch. This has no arch support. So
How does that arch, because I got really flat feet. I mean, there's no arch whatsoever. And, my son kind of inherited mine. He's starting to get a little arch through treatment, but he kind of inherited my duck feet that just hit that floor. And how does that affect the whole body, and how do what kind of shoes help that in preventing those kind of damage that a flat foot can have on you?
Well, it's three things I usually recommend with a good supportive shoe. And I guess I'm a two-part question. As far as like a good shoe, usually three things I recommend with good shoes. And it can vary per person and foot type. But one is a stiff sole shoe. And when I say stiff sole, I mean that when you pick the shoe and you bend it, it should bend a little bit. But the key thing is that the front of the shoe doesn't go past that first lace. If you can basically, I tell people you can curl it, put it in your pocket, go home with it. That's too flexible. You don't have a lot of shoes. Now, caveat to that is that if you go a minimalist shoes, where some people do, it's kind of what they consider barefoot running. That's a whole different story because they're in the more flexible foot type, flexible shoes to get their muscles to kind of help support their foot when they're running. But anyways, that's a whole different story. But a stiff sole shoe, good arch supports, and again, that varies on what your arch is. In a flatter foot is really making sure you have too much of an arch, because that's one thing people do is getting too much of arch support. Even when they get custom orthotics, sometimes they put them on a higher side, and then when people have to go back to kind of slowly lower it, because that can put too much stress. You can imagine your foot, if you have a decreased arch, and you got a super high arch, and you walk in it for more than 6 hours a day, your body's like, hey, there's a lot of pressure. I'm not used to this pressure. So you gotta kind of break it in a little bit, or even lower it down to kind of decrease the stress on it. But stiff sole shoe, good arch support, and a good heel cup. Because when it comes to your heel, the heel's the captain's, and where the heel goes, it mans the rest of the ship. That heel can shift the whole body. And definitely with a flatter foot type or even a high arch, that heel shifts the rest of the foot. So again, a good neutral arch will help kind of man that foot into a good position. But
when you don't have a good shoe, how does flat feet affect your body? What effects does it have all the way up?
Well, I mean, absolutely. So you're saying, when your foot's flat, and especially some people can have one foot that's more flat than the other, and vice versa. What happens is your body starts compensating, or say it doesn't, and you have a more rigid deformity. That right there can throw your knees. Actually, people sometimes who have really bad flat feet can have what they call knock knees or genu valgum, and that directly puts stress. So you imagine if your knees and legs are straight like this. Genu valgum is if your knees, my hands and my knees, they're going inwards. And what that does, one, that causes pressure on the inside of the knees, can cause, over long term, can cause basically a knee arthritis, put more pressure on your meniscus and causing arthritis. Also throwing off your hips. So now your knees are going this way, your hips are going out that way. And basically, I can put pressure on your hips, and long term cause pressure to your back. Your muscles in your back can be thrown off. You can get and if your body starts to want to compensate for that, your hips can be all off tilt, and that can cause pressure to the muscles as well as the back. And people would get go to a chiropractor to get adjusted and stuff like that. But definitely, I mean, I had patients before that actually had knee problems, and just happened to be that they had I'm gonna say plantar fasciitis or something like that, some common foot problem, and we treat that and give them a good insole. and they'll say like, I had my knee or my back feel so much better just by fixing my foot problem. If people don't realize it, and then also we can even tell sometimes people are compensating because it goes all the way up. Sometimes your back can compensate the structure of the back, and also the shoulders. The shoulders can be off tilted because of the foot problems or their knee problems or hips.
Oh, wow. Like some people may not, they may not think about that, but that's holding your whole body up. And that's why I definitely wanted to kind of get somebody to talk about that, because every day we're on them. Every day we're moving on them, and they could be affecting you all the way up. Now, is there any truth? There's a thing that's been said. If you wear high heels, that causes bunions. Is that true? And talk to me about bunions and what they are.
So I say one common thing is that people used to think that bunions are just due to shoe gear, and which absolutely shoe gears do contribute to it. But actually, more recent studies look at tribes that don't wear shoes and they still got bunions. So now genetics plays the biggest role. So I'll tell people we can blame your mom, dad, grandma, grandpa. Somebody passed it down to you. Like what my doctor said back in med school, it's like diarrhea and runs in your genes. So and then one thing we can't do is we can't get away from our genetics.
No, absolutely
So
not.
a lot of times you are more prone to getting it, but absolutely shoe gears, weight, activities, injuries, I think some other things, but a lot of those things can play a role in how bad a bunion gets. I've had patients that vary as far as even family members where one just happened to have and I say that my first line of treatment for bunions is supportive shoe gear, because that can decrease how bad a bunion can get over time. It helps by supporting that foot. But definitely I've had patients who gotten bunions. Oh, give me 1 second. I'm sorry. But the bunions, I'm sorry. But I've had patients who've had family members who they both same mom, same dad bunions. One has terrible bunions. One has a bunion, but very mild. One's been on their feet all their whole life and steel toe boots, been doing hard work. There might be a little bit overweight, had injuries, played football back in the past. Another one kind of had a remote job on their feet off and on, and one has it. So that can vary. And even that, how much stress they put on their foot, how bad the bunion can get,
Is it because the foot kind of rolls and it rolls onto that what is it, tarsal or metatarsal? Is it because it rolls onto that and that's what kind of gives you the bunion, or starts with the bunion?
Well, that plays a role. It's kind of it's multi, and I was trying to basically most layman terms. They're the muscles and tendons, and they even some people can be more prone to bunions with their foot type. Example, I know we kind of got on the flat foot because your plantar fascial ligament helps support the arch. As that plantar fascial ligament loosens up, that can loosen up that the ligament right here, tightness, and also the tendon on the side of the foot, because the foot's going, instead of being up like this, is going out more like that. This tendon, you have a tendon over here called the peroneal longus tendon, that actually attaches to that first metatarsal, which is what actually causes that pressure, that bunion. And if that also loosens up, now you have loosened that ligament, your plantar fascial ligament, loosen the tendon right here, and it makes this area, that first TMTJ, where that connects to the knuckle right there, that bunion, loosened up. So over time, instead of sitting straight, that knuckle starts going more and more out, and that causes that prominence that people know that bunion. And you have a tendon on top of here that gets tightened over time. Now your toe is going one way, so you got your knuckle going out this way and your toe going out. So it can it's multifunctional in that sense, but definitely catching it early. Sometimes people have juvenile bunions, the younger kids, and we'll try to give tips and have them understand. But again, people live their life and people want to, look a certain way and they want to be comfortable. So, like example, heels. Definitely, we see patients who wore heels who are prone to bunions and wore heels in their younger years and kind of paying for it now, where their toes are going the other way or suffer crisscrossing over. But definitely, surgery is never the first option. We always consider conservative treatment, whether that be pads or spacers. Even sometimes people have joint pain. We'll give them injections.
Wow.
But we try to leave
and you have a situation where that bunion is bothering you. You said surgery is never the first thing. One of the things that got real popular there for a minute was those shoes that you could actually crank and it brings your toe the other way. Are those things, do those things actually make your bunions disappear? Do they work as advertised?
So I have patients that actually had too, and there is two settings that you can see those really working in. One, let me say this before I do that. the tightness of the ligaments and tendons do make that bunion more rigid and make it harder to correct. So you can loosen it up a little bit because I even saw a YouTube video where somebody was getting a massage and they cranked it out, and but it's kind of like chiropractor in a sense. When chiropractor, you get adjusted, that helps it temporarily, but you have to do the stretching long term and everything. So something like that, even with that type of brace or not, it would be more long term. You might get a little bit of correction, but it's never get the correction you probably need because these people who are using that are pretty far off where they're like looking for example. That same thing I treat with people with fungal toenails. They try to over counter things, but a lot of times by the time you notice it, the over counters are you're past that. Usually the more milder cases, for example, those cranking those devices that crank it over, that's for more mild that you probably get better, but by the time you catch it, it's already past that mild stage a lot of times. But those type of devices, they work in two settings. One is if somebody uses it as an adolescence, which means they have to use it probably as they're growing up. By the age of 7, you're typically getting your adult foot. So you probably want to use that for years. But the one thing is that kids don't like stuff on their feet and take it off real quick. So that typically doesn't work. Or after surgery, because after surgery, all your tendons and all your soft tissue loosened up. So I've had people have similar devices as those that will use it after surgery because now all your tendons, everything's loosened up. And now we're going to keep it in that correct position while everything's scarring down and healing up. And that actually does work in that. But to take quote, a virgin bunion and think you crank it over and you call it a day, that's not going to work. And you might get some mild results, but you're not going to get the results you're looking for a lot of times.
It's not going to remove it. Now, you have one of the most painful conditions that I had in my foot is plantar fasciitis or heel spurs or whatever it is they call it. And it was absolutely painful. And anybody who's gone through plantar fasciitis knows about this. And it's a lingering thing. It isn't you can do one thing and it's over. This thing could linger and come back. So talk to me about plantar fasciitis, the causes, and what can people do to help them heal faster?
Sure. So, plantar fasciitis, is the plantar fasciitis ligament runs from and I know my foot, runs from your heel, is this your heel bone, to the ball of the foot. It helps maintain the arch. The one thing is that the inflammation, what happens usually most commonly is micro tears in that plantar fasciitis ligament that causes the pain. And that's actually important because if you look online, it says heel spur syndrome. So people will think that the heel spur is the problem with the plantar fascia. You get heel spurs because the plantar fascia ligament is really tight. The tightness is what causes the tears because it's so tight that when you walk, you get micro tears in that plantar fascia ligament. And that tightness pulls on that heel bone and causes a spur. A lot of times people see that spur even on x-rays and like, oh, that's a problem. That's not really a problem. It's a result of your ligament being tight. That's actually why a lot of times plantar fascia, more long-term solutions, is actually stretching. And I know a lot of people like to hear that, especially when you're in pain. Patients like, I don't want to hear stretching. I stretch all day. Well, you might not be doing the correct stretching. And also your Achilles tendon plays a big role on that plantar fascia ligament because your plantar fascia originates from the bottom. Your Achilles attaches on the back, and the Achilles is the strongest in your body. And a lot of us get tight over time. One, because as we age, just, our from a DNA, we change a little bit as we get older, but also we're not stretching out like we should be. We're just living life, just making it through life. So that's why you hear called the weekend warrior, because you don't stretch all the time. And then somebody challenged you, like, I used to run this when I was, in 1980s. You go and pop Achilles or pop a hamstring because you're just tight.
Yeah.
But that being said, the tightness causes that plantar fascia to be really tight, and whether it be just overstretching activities, people getting new activities. Again, that's kind of the weekend warrior I'm talking about. How an activity I was stretching out and gets those micro tears. Weight causes a big role. That definitely, I would say, the most amount of plantar fascia I ever seen was 2021, 2022. And what happened? 2020, everybody's at home staying safe. Then they're like, okay, I gained some weight. I'm feeling sluggish. I get back in shape. They go straight to the gym, go 100 miles per hour, or just try. Even I have patients that do small stuff, and that plantar fascia ligament and that Achilles got really tight, start and micro tears in that area. So we saw that's the most amount of plantar fascia I've probably ever seen was 2021, 2022.
People started walking again and exercising and trying to get in it. Now,
exactly.
There's something I witnessed a Achilles surgery recently.
Mm-hmm.
It was pretty cool to watch it. I watched it all the way through inside the OR, and it was just fascinating the way that they heal it and how the body works to put that back together. I was so fascinated by it. I was like a little kid at a candy store. It was just so amazing to me that they were, for them it was just another day. They were getting ready to getting through it, but for me it was just fascinating because it looked like a bunch of fibers just torn, and somehow they tie it all together, run a tendon through a bone, the heel bone, and to hook it up, and it was just it was crazy to watch, and that the body heals that. But what are the common things that you see that bring patients in with ruptured Achilles or maybe strained Achilles? What brings those in?
And a lot. So as far as where I'm at, my setting in Ellis County, we don't have as many. I'll say we might have occasional, I hate to say weekend warriors per se, that usually causes Achilles tendon ruptures where somebody's doing something that used to, or not properly stretching out, being tight Achilles, and then doing something playing basketball. But most times, especially, and I have a high geriatric, I would say, population, and a lot of my patients, it's just a minor injury, which is unfortunate because I have patients that are just walking around the house and it got caught in a step and stepped wrong and pop, or minor injuries, or where they just fell on a curve and just hit their foot wrong, and that foot went up too high and it caused pressure on that Achilles, and then fell to pop. But it can be big injuries, can be minor injuries. Did you remember Chris Halbert? Did you see his injury at NBA when he popped his Achilles?
No, I didn't. But I've seen them. I've seen them what they look like when they pop.
So I remember I watched the game, and he was just dribbling and he cut, and his outfoot, and you see his leg going like this and it just give out. And you can actually, I saw through his sock, I can see the Achilles. And I when I did that, I'm like, he's out for, you know. And we actually I had a discussion with one of my friends, because we were asking like, why are all these NBA players having Achilles tendon ruptures? And is it from, and it's younger players too, is it from overtraining? Is it from improper preparation, whether it be stretching or taking care of themselves? I'm not sure. Diet. I'm not sure in their condition. I don't do those type of athletes, and that's a whole different league from what I treat on a daily basis. I have your geriatric patients, but yeah, usually it's over tightness of, or even minor injuries. Usually people who have those Achilles tendon injuries usually have underlying conditions that already, like they had Achilles tendonitis already that was not treated. Myself, I play softball. We actually start softball up this Wednesday coming up. And every time the season comes, my Achilles starts hurting. So I'm always stretching out. Actually, I'm a stretch at night. I have tight Achilles. I'm gonna lie, but again, I had an 8-month-old and I got a 4-year-old. So right now, I said I'm making through it. I'm just making it through it. When it comes to athletic wise,
chase them.
Yeah.
Now, one of the things that I've seen when I've seen those injuries in sports was somebody jumped up, like for Dre Greenlaw in the 49ers. We were in a playoff or Super Bowl, I can't remember. And he was going back to get back on the field, and he kind of jumped out of excitement, and that's where it would pop. Is it that jumping or instant motion that is more likely to get you in trouble?
Yeah, so exactly. So that quick motion, but again, with something like that, it could have been, again, they're those type of athletes that overuse. They're working so hard and they're already like tired, and the tissue's getting relaxing, especially from a relaxed position, just resting and taking that big jump. And that's actually similar with I was talking about Halliburton, where he's steady and made a quick cut, and that pop, And a lot of times you see, if you hear it, and you can even, I remember watching something about Kobe Bryant's trainer talking about I don't know if you remember his Achilles when he popped it. He shot his free throws, and but he even said he said he's going to trainers like, I thought somebody kicked me. You ever see that? Some people like will kind of look behind like, this might just kick my back on my leg, because the way it snaps, pop. You feel like somebody just like knocked you.
Yeah, no, I never want to deal with that ever in my life. So I'm very careful, especially as I'm getting older. I stretch for just about everything I do because I'll pay if I don't. But before I kind of close out the show, because I could speak to you all day on this stuff, how how important is foot health? Because people don't, podiatry and dentistry kind of send the thing. They don't go into it until something's hurt. Can you talk about how important foot health is to people and why they should be coming in?
I mean, and I definitely, I mean, it's important to me. You imagine you spend these feet keep you going for years. I mean, all day. They don't ask for help. They just do whatever you tell them to do, you know. And sometimes they do more than we probably need them to do, or more than what we want them to do. So I mean, when they say the dogs are barking, you know, like let feed them or let them, let them rest. Give them time to rest. Again, you have to do what you have to do, in life. But definitely checking out. I mean, if you have small problems, I mean, even if it's a little icing, and that could be. I don't want to take it the wrong way, because we do have patients who are diabetic. You don't feel their feet, so and you have to ice. Make sure you know that it's not too cold, or if it's warm, Epsom salt's not too hot. But give it time to rest, relax, and good supportive shoes. I mean, that can save a ton of problems. Supportive shoes, insoles, that's something that you can add on. But start with the shoes. Make sure your shoes are supportive, and if you need some insoles, add on from there. But the shoes are, your foundation. And then they wear down. I mean, if you have shoes, and I tell people, if you have shoes and you put them down and you look at them, if they're tilted a certain way, or you're worn down and you having foot problems, switch them out. That's an easy solution. Get something that's gonna help support your feet and keep you going. A lot of us are living long. We want to make sure we have least problems as possible, and just taking good supportive shoe gears might check one thing off your list. You have to worry about as you get age.
Yeah. No, I mean, it's something you're on every day, and people don't think about it until, ouch, 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 and something's hitting them, or bunions killing them, or it was absolutely, and I mean, Hoka, if you want to sponsor me, by all means. It changed my life. That
Mhm.
Hoka changed my life. Wearing those damn Bondies just I mean, they are not the coolest looking shoes. They're not.
Mhm.
But they're like walking on pillows. And like everything, the knee pain that I was getting, the kind of, I have a very bad back. It helped with all of it, all the way
Mhm.
up. And I mean, I am such a big fan of those Hokas. And even if they do, look kind of funny, I don't really care about that. I want to take care of my feet. But how could people come and talk to you or see you if they want to get their feet treated?
Oh yeah, so we're a family. I'm part of Family Foot Ankle Centers. We have a clinic in Waxahachie, where the old house used to be at, near Gessendator Park, and then we also have a clinic in Ennis, Texas. That is just not far down the street from the HEB or the hospital. I'm off of Lampasas and Clay. They're more welcome to see us. We'll definitely take care of them. We see all kind of conditions, whether it be a ingrown toenail to a sprained ankle. We take care of all of it.
All of it, all of it. Well, I want to thank you so much for coming on and talking about this issue. I mean, we deal with it every day. We stand on them every single day. Can you hold on after the show real quick?
And no